the concept of report back. So we're going to spend some time simply talking about report back as a vehicle for community engagement, for sharing and communicating in bidirectional and multidirectional ways. We're going to see it as maybe a foundational tool for building and continuing your connection with your community partners. So I want to share with you this concept. If we're looking for a good definition, report back is the sharing of research findings with participants. And when you share this information, you're noting comprehension, knowledge attainment, and any resulting behavior change. I really like that last part of the definition because the science of report back is really just starting to pick at the idea of what kind of behavior change can result from sharing information that is really precise and individual with the participant that you're working with. So we really come to know, particularly with this this National Academies report, it's called Returning Individual Research Results to Participants. This is a great report, as in it kind of brings together environmental health exposure and biomonitoring findings and how we share that information, and also in the realms of genomics and genetics and how individual results are returned back to those individuals in that realm of science. And it kind of brings them together and shows best practices and what we've learned so far in this new idea of sharing information to those from which that information came from. So we're really coming to the conclusion, and this was one of the important takeaways from this report, that report back, sharing these research results that ultimately came from the patient or from the participant or from the client, they are their results, and how can we share them and bring them information. So for myself, I think of this as important because I work in the realm of adolescents and asthma and their environmental exposure. So for me, the idea that I need to share report back results may help my participants and improve their asthma outcomes even. So I would like to share with you, as we grow to understand this concept and talk and discuss this concept, I want to share with you a review of the literature that I completed with colleagues to show you what we kind of know about report back at this point in time. So we undertook a systematic review and looked at a number of databases, and we really tried to dig in and get some different keywords involved because report back is a fairly new concept or a new way of identifying this concept. So we did make sure that we looked at key terms such as biomonitoring, environmental exposures, communication, environmental risk communication, and we were interested in this concept. It's also a newer concept, environmental health literacy, how all that kind of ties together. Environmental health literacy, I think it's good for us to bring that up, is really the idea of how well people are aware of environmental health, how literate they are in this really broad area. So with healthcare, you have many different diagnoses and you're thinking about health literacy. Well, in environmental health literacy, we also have a very vast number of areas. Do you have a certain level of environmental health literacy when it comes to water quality or air quality or personal care products exposure? It's a really vast topic. So it's a great concept to kind of wrap your head around as well. So for this review of the literature, we really wanted to kind of keep those articles that we could find that were really sharing results, sharing that information, doing that report back process with sharing those exposure experiences and the data that was collected with the participants. And we really tried to stick to peer-reviewed journals. So what did we find? When we looked, when all was said and done with this particular systematic review, we had 17 articles to look at. And I want to give you, I don't want to delve into the systematic review process, but I want to share with you some of the gems that we learned as we were reading these articles and trying to mold and share this systematic review of the literature. So what we found was that the actual sharing of information really seemed to tune up and have an avenue for environmental health literacy. It increased and allowed participants to gain knowledge, particularly in chemical exposures when we're thinking about environmental exposures. Participants were very interested in understanding where these exposures were coming from because there was a lack of knowledge in how toxins infiltrate your home. So some of these articles talked about the idea that your home is your safe haven and that your home would really be able to, that you are safe within the walls of your home. And so really trying to get people aware of maybe some of the chemical exposures or environmental exposures that are within the home was very eye-opening for these participants. And it's important to give context. So data in and of itself doesn't always have enough meaning. So when you're sharing data results with your partners, your community partners, those individuals that aren't immersed in the science enterprise or the academic enterprise, you really want to share with them some context. So if you're going to share with them air particulate matter levels and air quality within their home, then share with them the air quality at the outdoors, or share with them a safe range, or share with them, if it's a group that's willing to share, you can share their individual results and then the group aggregates to kind of give them a sense of where they may lie in the field and in the landscape of this data. So give that data meaning and give it context when we're sharing this data. We found some interesting emerging trends as we tried to delve into this idea of report back and sharing results. As I said, a lot of times we don't know where these exposures are coming from, particularly in our homes and our own bodies. So really thinking about and having those discussions about household air and dust and what may be found in your own body and in your own blood. And we were even using in the environmental health world, we're using terms like exposome and everything that you're exposed to in your space and across time. And then we're really trying to think about, how does your body absorb these exposures? What's found in your blood? What's found in your lungs? How does this all work? Really, there's a lot of room for growth and science translation here, as long as we really think about how people consume science. So really, again, emphasizing the idea that we need to interpret results and provide comparisons and normalize results. So a lot of the chemicals that may be found in a vast biomonitoring study, there may not be federal guidelines for those results or understanding of those results because our environments are full of different chemical exposures. So how do we normalize that? How do we normalize it within the group? Can we provide better understanding? You can imagine that these processes take time. There may be unknowns for the investigator that they need to go and do some more research and come back to their community to provide some extra context. So you can understand that as, right along with community engagement, completing report back and using report back strategies with our community partners is also something that takes time and must be built in and must happen along a period of time before and after data collection. As we continue this, it's important to help your participants understand sources. So recently in a study that we completed of household indoor and volatile organic compounds, we really needed to talk to our environmental health experts, those that work in the field, those individuals to talk about where these different chemicals may come from. Does it come from gasoline that you store in your attached garage? Does it come from a hobby because you have a unique hobby that involves different chemicals? Is it an occupational exposure that comes back home because you use epoxies and things like that in your place of work? Or dust and you need to remove your boots and your coveralls in the garage and maybe you haven't done that previously. Freons and different things that we use in air conditioners and different modern conveniences. different personal care products that you may use, acetone to remove your nail polish, those sorts of things. We need to help our participants think through these processes to understand what their data mean and where those data may have come from if it includes unusual or high-level exposures that we weren't anticipating. So we really need to talk to our participants. And many of the studies that we looked at, often an investigator will be concerned, do I want to share this with my participant? It may be even considered a bit of a paternalistic attitude, like, is this okay for them? Can they handle this information? And by and large, many of the studies said yes. Participants, more often than not, were very interested in understanding their own personal data, but they would often, as you can imagine, need a guide through that data, providing the context and the comparison and the normalization. We did find that timing to return results is critical, so therefore the planning comes into play again. Do you have a plan, and can you turn around those results fairly quickly? Or if they can't be returned quickly, can you give an accurate time frame so that your participants know when to expect them? And can you maintain good communication in the interim until you get that data to them so that you have this rapport and this continued relationship? So those are important things to consider. So as you're doing this, you know that when you're working with your partners, your community partners, they will grow and they will learn with you through these processes. They will gain more exposure knowledge and more exposure understanding. So it's this great combination of sharing data and also doing science literacy and science translation as you grow together and provide context in great learning environments. And then finally, when you're providing comparisons and normalization and understanding, you need to make sure you're thinking about the cultural and linguistic and even science literacy needs. Each community is different. Every community comes from a different organization, a different community partner, a different generation maybe, a different cultural background, a different gender background. And all of these things shape their learning style and their learning patterns and their ability to connect new information to old experiences. So you need to be aware and understand your community partners and where they're coming from, ask questions, and really think about how you can provide this information in a way that's very relevant and contextual and helps them grow and understand and therefore use this information. So let's recap a little bit. Report back helps people understand the exposures that are already in their lives. And as they understand this, it increases their awareness and knowledge. Participants often are interested in receiving these exposure results. The literature, by and large, showed that there was an interest and it was more positive to receive those results than negative. Timing is critical and it's important, so think about it when you're planning your report back. Report back should be planned at the beginning of any project and hopefully not as an afterthought. It's more useful if it's planned ahead of time. If you want to think about this process and how your participant moves through time, just know that they are learning with you. There's a lot of co-learning. And as we've said in community engagement, we're co-creating, and with report back, there can be a lot of co-learning because your participant is providing context that maybe you didn't think about as the investigator that's not engulfed in that context. And then always remember to take the perspective of your community partner, your participant. What are their cultural and their linguistic and their science needs to make sure that you're communicating as effectively as possible. So now this is a great time to share some resources, especially if we've piqued your interest with the power of report back and its potential. So again, I like to remind you of the definition, just to share it with you, that it has a number of pieces to it. So we're really thinking about how our participant comprehends what we share with them, how much knowledge they're holding on to, and how that knowledge may be prompting change, behavioral change, which any of us know behavior change is really hard. We really need to build habits. It takes time. And so making things relevant and very personal can be an effective tool. I want to share with you some of the interesting work that's been done as an example of resources from the Silent Spring Institute in Boston, Massachusetts. I encourage you to check out their website because they have some great projects and some really important focus on report back in the way that they do their research. So some of the tools and some of the interesting write-ups are on this screen. So there was a great op-ed about their Detox Me study that was collecting urinary samples and sending back findings for each individual. It was a kind of crowdsourcing project that you would fund as an individual, and there was a write-up in the lay media about it. So it was called What Poisons Are in Your Body. So I encourage you to check that out if you're interested in a lay media perspective. There was also a Stat News article about this work. So you'll see the headline right there in the bottom left-hand side. There's a lot of publications, both lay media publications and academic publications that you can kind of dig into to see some of this. The one that I want to point out the most to you, though, is a really great resource that was funded by the NIEHS. And it's a handbook called When Pollution is Personal. So it's a freely available document on the web that you can download. It was also published in an article related to this was published in Environmental Health. You'll see the DOI number there on the screen. And we're going to open this up and I'm just going to share with you some of the table of contents to just show you, because a lot of times you can share resources and sometimes it's just hard to go and seek them out and find them. So I want to make sure that I share with you this table of contents to keep enticing you to see what a great resource this is. So chapter 1 really talks about how you get started and really emphasizes the idea of planning ahead, deciding what to report, anticipated costs, roles and responsibilities, informed consent, and legal issues. So this helps you sometimes, depending on your institution or where you work, the IRB process may not be as aware of this. So there are tips and tricks in here to help you navigate that and learn together and work with your IRB, which is very important. Chapter 2, just to the right, talks about methods for reporting. So acknowledging that every community is different and you really need to use principles of risk communication, and you need to decide what you can and cannot report. As I said, the literature says that participants are very interested in receiving this information. However, you may choose to phase it in, report back in at different sessions, report back what you readily know and are confident with at first, and then the other more unknowns later. This will depend on your rapport with your community partners, timing, your timeline in general, your funding, all these pieces. So there's a good overview to help you think some of these things through. Chapter 3 is evaluating your report back. So can you improve upon this? Is this work that you will continue, and therefore there will be many lessons learned and the community partners can give input on that? And then finally, I love this because I'm a very visual learner, and they have a great appendix that gives you examples of report back documents that they have created with these ideas of context and translation. They have an English and Spanish version of certain things, fact sheets. How do you share things? So great tools to help you do this effectively as well. And here, even in the very beginning of the document, they have 12 tips for reporting personal exposure results. So it's like a nice overview to get you hooked into this process and to give you some really good understanding of what is needed when you're sharing report back results. So it's a great place to start. And here is exactly the tool I was showing you. In the appendix, there's a how to read this graph. And they show different portions of the graph, and there's an exact version of this in Spanish as well. Again, this is science translation, really bringing your participant along on the journey, helping them understand for themselves what the science is stating in a way that's understandable, and translate it. I myself am a Spanish speaker from a very young age, and I love this approach because I feel like it's really like learning a language. And so they're giving you the tools to help your participant learn the language of science and really make it their own. So in closing, you want to share results. That's part of the report back process. We feel as a science community it has become an ethical best practice, so plan for this and plan ahead and plan throughout your project. Know that your participants are really learning from this process, learning with you, learning along this journey, and it takes time. It takes time, and timing is critical. So make sure you're having a back and forth discussion, multiple ways of communicating and really thinking about it and getting those results back to the person so they can put them in context in a timely manner, especially if it can promote healthy behavior change. And then finally, don't forget the uniqueness of your communities that you're working with. You really want to think about their cultural, linguistic, and science learning needs so that you can tailor your report back to the best of your abilities.